Good evening. My name is Anthony Costello. I'm from University College London, and it's fantastic to be hosting this side event at the very first Planetary Health Alliance meeting being held in South America. I'm going to start by just telling you I'm one of the co-chairs of the Lancet Countdown for Climate and Health Action. And this was actually commissioned originally in 2007. So that's 13 years ago, when the editor of the Lancet asked us to do a commission through our university, a cross-faculty effort at UCL in London, University College London. And we published it in of the 21st century. And it got a lot of media coverage and a lot of disagreement at the time. Although I think that the disagreement now would not be so controversial. Look, we've done a second commission in 2015, and now we have annual meetings, annual reports rather, which involve up to 38 universities. So this is a global event. And this is an important year. We have the Climate Summit in Glasgow in December. We have a lot of speculation about nationally determined contributions, and we're hoping that we're going to get ambitious targets from countries like the US, China, the UK. In this session, we're going on with discussion about our Lancet Countdown regional centers. And then in the second half, my colleague, Marina Romanello from Argentina, is going to lead a discussion about the planetary health programs that are going on in South America. I just want to start, if this works, by sharing my screen just to show you some introductory points about, let me get rid of that. Oh no, don't do that. Continue. And I'll just play this very quickly. So the 2020 report was last December, and we called it Responding to Converging Crises. As I've said, this involves a huge and growing number of countdown partners from around the world, and we now have a regional devolvement, and we'll be talking about that for the first session. We have 120 authors collaborating who do a fantastic job. This is just a small fraction of the people involved that was taken when we had our last meeting of the group in London. Sadly, that was 18 months ago or more. And we have 43 indicators published across 5 sections on climate change impacts, adaptation, mitigation, and health co-benefits, the economics and finance of climate change, and on public and political engagement. And we've got new indicators. I'm not going to go into those now, but if you want to download the report, it's absolutely free. Just type in Lancet Climate and Health Countdown and you'll be able to get it. Now, really, we've got 3 key points coming out of that report last year. It's the worst outlook for public health since our inception. That's how grave the situation is. No country is immune from the health impacts of climate change. All kinds of things are happening: extremes of heat, food and water insecurity, infections, wildfires, and the like. And this pandemic has provided a glimpse of this future. Secondly, that the COVID-19 pandemic has shown how these crises will converge. And as we come out of the pandemic, if we learn from the pandemic and realize that we have to act together in a multilateral way, just as we're going to have to get our vaccine act together, which we're not doing at the moment, we've got to do the same thing to have cleaner skies, healthier futures, healthier places to live, and poverty alleviation. And finally, we said aligning the global recovery from COVID-19 with our response to climate change offers a triple win. This is all in our interest. It's going to improve public health, it's going to create a sustainable economy, and it's going to protect the environment. But time is short. If we don't tackle these converging crises, we're going to quickly, within a decade, move the world out of reach of a 1.5 degree target. It threatens our children's future, and it's going to damage the health of 7.8 billion citizens and growing in both the short and long term. On that point, I will stop our share. I'm going to say, whoops, how do I get there? There, stop share. I just want to say there's a Q&A function at the bottom here. If any of you have a question, please do raise it and we'll come back to it in our panel discussion. But for now, I want to introduce our first speaker from one of our regional centers. We're going to look at Europe, look at a film from our China center, then from the University of the West Indies in Jamaica, and finally we're going to go to Peru and to get their Latin American perspective as well. But our first speaker is Professor Maria Nielsen, who's been with the Lancet Countdown for many years. She's a research fellow and associate professor at the Department of Epidemiology and Global Health in Umeå University in Sweden. She's going to talk about our European work and the recent launch of the Observatory for Europe and the publication of a joint paper with the European Environment Agency. Over to you, Maria.
Thank you so much. Yeah, it's been a pleasure to be part of this important work since many years now. And I think we all agree that in saying that health is in the heart of most transformations needed to achieve global sustainable development. And although human health has improved substantially since the mid-19th century, 1950s, the gain was accompanied by human activities, causing loss of biodiversity, pollution, and an overuse of natural resources, and of course, climate change. And all of these challenges threaten human health and the ecosystem services on which we depend. The Lancet Countdown is working strategically to expand its network by establishing national affiliates and regional centers in key locations around the world. And these are looking at the local and national implications of climate change on public health. And also, of course, the European Union is a key partner, and European Union member states have a pivotal role to play in the response to climate change and its impacts on populations. And the EU is already responding to climate change in various ways, including with regard to financial investment, regulatory policies, support for international commitments of different kind. And the EU is taking important key steps in improving the knowledge base for policy action on climate change and health. And one of those key initiatives now is the European Climate and Health Observatory that was launched in February earlier this year. And it's coordinated by the European Commission and the European Environment Agency. And the Lancet Countdown is one of the central partners in this initiative, contributing with indicators, insights, and analysis. And in supporting the European Environment Agency in developing this observatory, we have drawn from our strong partners across Europe to contribute data to this effort and to report on the evidence and policy opportunities that we see exist for Europe. The Lancet Countdown on Health and Climate Change and the EEA have, as a collaborative effort, produced a report of the evidence base and the current policy context, and where Europe should be focused to address the risks that climate change poses to our health. And the report looks at 3 areas: its impacts of climate change on health in Europe, its climate change adaptation and mitigation, and health policy in Europe, and policy context and policy opportunities. The report focuses on a few selected health impacts of climate change in Europe, and those include climate-sensitive diseases. They also include heat and heat waves, droughts and wildfires. To shortly mention a few examples of, I would start with infectious diseases, and there we see in 2018, the environmental suitability for the transmission of dengue by its mosquito vector in European countries increased by over 40% compared to the 1950 to 54 baseline. And we've also seen in the past 5 years, the proportion of coastline suitability for the transmission of the Vibrio bacteria, that it has increased by 61% in the Baltic region, and that is compared to its 1980s baseline. And Vibrio can cause gastroenteritis through the consumption of contaminated seafood, and potentially also serious lethal wound infections through direct exposure. And people who have a suppressed immune system are particularly vulnerable to this. Then some consequences of heat and heat waves. In terms of mortality, the hot summer of 2003 resulted in an estimated 70,000 excess deaths in Europe, whilst the 2015 heat wave caused over 3,275 deaths in France alone. We can see that European countries are increasingly affected also by weather and climate extremes, which lead to fatalities and affect human health and well-being. For example, more European countries suffered from wildfires in 2018 than previously recorded. And this included several of the northern countries and also Central Europe. In the report, we discuss the health and climate change policy landscape in Europe and some further opportunities for increased ambition with a specific focus on adaptation. Our report describes some key findings, and on this slide, a few are mentioned. There is a concerning increase of weather and climate extremes across Europe. We see that Europe's population is increasingly at risk to heat extremes due to aging populations in Europe. And we also see ecological conditions that increase the capacity for infectious disease. But we also outline how the European Union is placing the health narrative within our current pandemic response. We also see that a range of policies on adaptation and mitigation exist, which may be further promoted by the European Green Deal. We also outline how national adaptation plans recognize human health, though we need to better understand effectiveness of solutions. We stress also the importance of further involving health professionals in how we prepare and plan our response to climate change. Our frontline health professionals are really critical to this response. And then finally, the launching of this European Climate and Health Observatory will play an important role in knowledge exchange and translation and in the development of tools. Thank you.
Thank you very much, Maria. That's excellent. And you were absolutely bang on time. My job is to keep everything flowing. So thank you so much for that. Now, one thing we've had since the very beginning of our climate countdown is a fantastic relationship with Tsinghua University in China. And Peng Gong from there, who's an internationally known satellite physicist on climate, has worked with us, but also his colleague, Professor Wenjia Chai. Now, she is not able to join us because it's 3 o'clock in the morning in China, but we have a pre-record session from her. She's an associate professor of global economics in the Department of Earth System Science at Tsinghua. And Emma is now going to share her screen, and she's going to talk about some aspects of the China report from their regional center of the Lancet Countdown on Health and Climate Change for 2021. Emma.
Good evening, colleagues. Greetings from China. This is Wenjia Chai. I am an associate professor in Department of Earth System Science in Tsinghua University, based in Beijing. I also serve as the director of Lancet Countdown Regional Center for Asia. It is my great pleasure to meet you all here in this side event. Although I can't join the meeting together with you due to the time difference, I'm happy to present you the progress of Lancet Countdown Asia in this 10 minutes talk. Now let me share my screen. I have to say that 2020 is an important year for Lancet Countdown Asia because this is the year center. Even though Lancet Countdown has been so successful in the world, it is still unclear how climate and health are interrelated in the China context. In this sense, 2020 is also a milestone for health and climate change issue in China because we successfully launched the first China Lancet Countdown report and made this a hot topic in China. Our report has come at the perfect time. As home to 1/5 of population in the world and the biggest carbon dioxide emitter, we are quite aware that China's climate action will significantly improve the living environment and the health of the public. Meanwhile, 2020 is the beginning of the 14th five-year plan in China. And we only have a decade away from the 2030 Sustainable Development Goals, the Healthy China Action Plan, and China's pledges to peak emissions. If talking about China's 2060 carbon neutral goal, we only have 40 years away from it. Therefore, it is urgent to implement the principles of integrating health into all policies and to formulate a health-oriented climate action plan in China. Therefore, the 2020 China Lancet Countdown report represented an unprecedented cooperation among 19 institutions around the world and 77 distinguished experts. We have jointly explored the climate and health interlinkages in China. This is also an unprecedented interdisciplinary cooperation because we have experts from public health, climate science, atmospheric chemistry, energy system modeling, economics, ecology, and etc., which have never been seen in previous projects or studies in China. The China report has 34 indicators in total and represents the first endeavor to track all dimensions of health and climate change in China and its 34 provinces. For example, in the middle figure, we have identified the provinces in China marked in dark red color, whose health risks from heat, extreme weather events, and climate-sensitive diseases are all rapidly increasing. Although some provinces are marked in pink color, they also face at least one kind of health risks that are rapidly increasing. In the right figure, the most rapidly increasing health risks faced by each province in China have also been identified, you can see that health risks for each province are quite different. That is why we get to our key conclusions as shown in the first slide. No Chinese provinces is immune to the health effects of climate change, and targeted responses should be made for each province. The China report has received fairly well media attention. More than 40 well-known media agencies attended our launch event, including those most distinguished ones in China. One of the hot topics that's being picked up by the media is that heat-related mortality in China in 2019 was 4 times of that in 1990, which shows the threat is increasing rapidly and we need urgent response. I truly believe this trend could also be observed in other parts of the world. Because we have produced really important and evidence-based findings, our report has received strong support from governments. Our dialogue with policymakers have been attended by Ministry of Ecology and Environment, by Chinese Meteorological Agency, by Ministry of Science and Technology. And also after the side event, the launch event, we have also made this face-to-face briefing to the Environment and Health Division of National Health Commission of China. We have also been getting invited to participate in drafting the Human Health Session in 2035 National Adaptation Plan for Climate Change by Ministry of Ecology and Environment. We have also been invited to participate in the expert group of carbon peaking pathway design, also by the same ministry. In this year, or the second year after the launch of the Regional Center for Asia, we plan to continue to translate our scientific findings in 2020 report into the plain language which could be understood by the common people and promote these through social media. We also plan to organize more dialogues with decision makers so that they could understand our findings and to formulate further policies related to this. We also plan to provide robust support for decision-making in China. We really want to raise the public and the policymakers' attention on this issue and try our best to trigger more policy changes. So in all, thank you really for your attention, and I wish you enjoy the rest of the meeting today. Please feel free to contact me through the email. Thank you very much.
Thank you. That was fantastic. Hasn't she got amazing English? She speaks much better English than I do, very clearly. And it just reminds me of how important this is to have these decentralized regional reports. And I'm hugely grateful to the work that's done centrally by our team, Alice Magushian, Emma Frost, Marina Romanello, who've done an amazing job to support our regional sections as well. And actually, it's incredibly important to get research into policy and practice. In my career, I've been involved with a lot of studies around the world, and the lead authors should always be local, and they have much more power and influence in getting findings into policy and practice than any foreign investigators. So that's really important. Now, I'd like to move on. We all know that there are some countries in the world for whom climate change is an existential threat. And small island development states particularly are in the front line, whether it's sea level rise threatening the very existence of low-lying islands in the Pacific, or in the Caribbean, the annual threat of hurricanes and storms. So it's a great pleasure to welcome for our next talk from the University of the West Indies in Jamaica, Dr. Georgiana Gordon-Strachan. We had a great meeting with her and the team a couple of months back to talk about their work, and she's going to tell us, she's the director of the Tropical Metabolism Research Unit at the University of the West Indies, but she's going to talk about their new Small Island Development State report and what they plan to do in future. Over to you, Georgiana.
Thank you so much, Anthony. Welcome, everybody, and it is my pleasure to be here. We are kind of the new kids on the block, and we're just starting out with looking at setting up a regional center for small island developing states. So just to give a little bit of context about small island developing states, in my opinion, they represent some of the most beautiful places on earth. You think of small island developing states and you think of blue, beautiful beaches, lovely landscape, exotic foods, and exotic cultures. There are about 77 of us, or possibly more, and we make up about 65 million of the world's population. Although we are small islands, we are among the most vulnerable to climate change. And this mosaic of pictures shows some of the devastation that happened after extreme climate weather events. So the overall goal of the Regional Center for Small Island Developing States under the Lancet Countdown was really to bring together institutions in the Caribbean Sea, as well as institutions in SIDS, the Pacific region of SIDS, and also those within the region spanning the AIMS. And AIMS in this case means the Atlantic and Indian Oceans, the Mediterranean and South China Sea, on key issues relating to health and climate change. So our work began with a scoping report on the key issues relating to health and climate change. And we looked at two things. We looked at existing research, and then we tried to see if we could identify priority areas for research. So the overall objectives of our scoping exercise were, and I'm going to just summarize them really quickly. Firstly, to identify challenges and priorities regarding SIDS in terms of health and climate change. Then to determine the relevance to SIDS of the existing Lancet Countdown indicators, and to suggest modifications and possible additions to the indicators just to make sure that they are more relevant to us as SIDS countries. And finally, to determine capacities for research and collaboration. We used a simple qualitative method where we interviewed about 24 academic and policymakers within the SIDS, specifically the Caribbean and the Pacific Islands. And we covered several themes. We use a conceptual framework which was designed by the Lancet Countdown. So the 5 themes are listed here. The issues which were raised by the people we interviewed included some of the following. Firstly, global equity. SIDS are environmentally, economically, and socially vulnerable, and we can easily be devastated by climate change. Another issue that was raised was water security and access to clean water, and these were considered important challenges. Of importance to us as island nations is our ocean environment. Coral reefs being essential to us for the sustenance of our food. We use a lot of fish, eat a lot of fish here, and our economic activities are also attached to the ocean, tourism, fishing, and other activities. Coastal erosion is one of the issues for us because many of our settlements are around our shorelines. And if we have coastal erosion, it may lead to displacement of communities. Other issues raised were vector-borne diseases. Mosquitoes were of particular importance. Food insecurity was another, especially related to the less predictability of our weather patterns. And this is affecting our fisheries and our agricultural sectors. Also, of course, would be the impact of extreme weather events. One important issue which was raised is chronic non-communicable diseases. And this was raised within the context of what we now call the 3 Cs. climate change, COVID-19, and chronic diseases. One other issue which was raised, which is important to us, is the fragility of our health systems. And this was also tested during our recent and ongoing COVID-19 pandemic. So out of this, we were able to deduce some priority areas. And I won't go into all of them. What I will do, though, is to look at those, to just point to you those which I had not mentioned earlier. And that would be, firstly, the collaboration between agencies. So we need greater collaboration between our planning agencies, between our Met forecasting agencies, and disaster management. Another area which was reported as a priority area, which was deduced from our interviews, was research and surveillance, which linked climate and health. Another issue, government engagement. So out of these, we came up with what should be our priority research areas. Vector-borne diseases, air quality, and chronic non-communicable diseases were identified. So out of this scoping report, and I've given you some basic, just preliminary findings, a broad brush kind of sweep, we have developed a scope of work. And we intend to do 5 main things. Firstly, we intend to produce locally led research on the relationships between health and climate change that are of particular interest and importance to SIDS communities across all the SIDS regions. We intend to use this research to inform the Lancet Countdown's global annual indicator report. We know that our research is not that important if it's not out there and if it's not taken up by our policymakers. So we have a special communications component which will look at the launching of special events and research publications. We intend to develop a network of academic and research institutions within the 3 SIDS regions and to engage with national and regional policymakers, especially media, within the SIDS region to ensure that the impact of our research is felt. So we intend to do this under a framework of special themes. So there are 4 themes here for which we will be paying special attention to. And the first is to actually dig a little deeper, do a deep dive into developing the scientific case for investment in climate change and health in the SIDS region. The other we will do in collaboration with the Lancet Countdown, and that is to develop a bioinformatics plan, which we will utilize for measuring and evaluating and monitoring our indicators. Education and training is also an important aspect of what we think we need to do, and we intend to develop a program which can be open source to the other universities within the SIDS region. And this training would be specific to SIDS. And we would also like to prioritize what the study conditions should be. We intend to do this through partnerships, through communication, and through the development of a strategic plan which will ensure our funding and our sustainability. Please join me for our launch in September 2021. Thank you.
Georgiana, thank you so much for a wonderful presentation. And you make me think, because when I was a medical student many moons ago, I spent 3 months in St. Lucia working in a hospital there. And it was one of the most magical experiences of my life. And actually this morning I was on a call with people in the Pacific Islands wanting to do work with indigenous people. And the one thing I've learned from small island states is that people there have a much more mature relationship with the earth, with Mother Earth, their knowledge systems, their culture, their understanding, deep understanding of sustainable living is something that we need to learn from, because the big problem with climate change is our kind of Western economic mindset. But I won't go into that now. I'll just say I've been looking at the Q&A and there are 2 really challenging questions about is net zero just a smokescreen for doing business as usual? Is there another target we should use? Are all the politicians just doing what Greta Thunberg says is a load of bullshit? And from Eva Kazub, France, that climate change is just one part of planetary boundaries, and there are complex connections between them. Is it, why are we only choosing climate change? Are there other, boundary issues that we should be talking about as well? So hopefully those questions will come into the panel. I'm going to finish now and just introduce you the final speaker, last but not least, Professor Stella Hartinger, and it's great pleasure to have had her on Lancet Countdown. She's an associate professor at Cayetano Heredia University in Peru. She heads the Unit for Environmental Development, Health and Environment. She also co-directs CLIMA, which is the Center for Latin American Research on Climate Change and Health. And she's going to talk about the new regional center for Latin America in Peru and what they plan to do in 2021. And then she's going to go on and introduce the second half of the event, which will be moderated by my brilliant colleague, Dr. Marina Romanello. So over to you, Stella, and thank you in advance for your presentation.
Hi, Anthony, thank you. Thank you for having me. It's always a pleasure to be in the event with the Lancet Countdown. It's like a group of family and friends. So it's really, really nice. So I'm just going to give a quick overview in the progress of the Lancet Countdown in South America and how can you get a little bit more involved with us. So at the beginning, Anthony was talking about how did the Lancet Countdown came to be. And he was talking about all of the institutions of the 38 plus institutions that work in the Lancet Countdown and all the research or the researchers that participate to carry out this report. But I must confess that I was the only one from South America that was participating in this report. And I think that despite that the report follows most of the country worldwide, the problems and the impact of climate change for our region were not necessarily visible. And that is actually how the Lancet Countdown South America came to be. We are also experiencing everything that all of the people in the panel has been talking about: intensified storms, extreme weather events, crop productions that have been affected, worsening floods and droughts, and the spread of infectious diseases, including dengue, and this exacerbates poverty. So we're also seeing this. But I think that the Lancet Countdown South America, what it's bringing is that we are highlighting the regional problems that we are facing, bringing awareness to the region. And in the end, what we want is to prepare for this year, for this 2021, a sister report to the global one, where when I mean we is the South America researchers that have identified indicators that are important to us, so that we can talk and understand, because I think we are the ones that talk and understand about our problems. So who are we? We are the Center for the Global Lancet Countdown with the mandate to promote and develop research at a regional level on the impacts of climate change and health. And we will do this through research and partnerships where we aid to identify, study, and communicate effectively the impacts of climate change and health. So we're doing it through what exactly I'm saying. So the first thing we're doing is we're identifying our key partners in the region. We are developing research projects, case studies as we call them, and we are expanding our communications, our country level communications and our policy engagements. So through the partners, we've identified several partners and institutions that we can work with. Laura is actually here and she's going to be in the next panel. So we are identifying people from Peru. That was the first thing we did actually, but then Costa Rica, El Salvador, Chile, Ecuador, Argentina, Colombia. And we are also identifying other key partners such as the Pan American Health Organization, PAHO, that is very keen to be part of this process, and the Organismo Andino de Salud, that's Horas CONU, that we also work with them and collaborate with them actively, and they've actually been part of our launch since the beginning. So this is the first step that we take, and this is taking a long time to do and to identify, but I think that we now have a strong network that we could start working and do more things together. The second thing that we're doing actively in the South America Center is the development of this case study, is creating research. So for 2020, we've written and are about to submit, I must say that we're a little bit late, on two big and interesting topics, which is the impact of El Niño, which I know affects various countries in the region. And we're also working on identifying heat waves and the relationships between mortality and extreme temperatures. One of the key projects that we're going to work on this year is marine food security and nutrition in Peru. We are looking into the relationship of sea surface temperature due to climate change and alterations to fish stocks. We hypothesized that there's a relationship between fish species that have the preferences in relation to temperatures, and that these changes can be perceived in the tons extracted of their annual landings. With the conversions of the fish extractions to proteins, we can actually try to calculate the protein intake and see if this is having an impact in nutrition in different age groups and gender. And I mentioned specifically this research because some of the research that we're doing can be translated into future indicators for the Global Countdown or for the Lancet South America report that we're going to do right now. So what we've also done this 2020, if we have contributed to indicator 1.3.2, which is vulnerability to mosquito-borne diseases. One of our collaborators that's also here in the panel has actually worked on this thoroughly, and we continue to collaborate and provide the indicator 3.2, where we collaborate with some of the other researchers in the Lancet. As I was saying, we want to propose future indicators for 2020, and one of those is in marine productivity and nutrition. Another indicator we will still work towards too is tropical glaciers and potable water availability and health. Just a sneak peek, because I'm not sure if don't kill me if I can't show this, but this is the vulnerability to mosquito-borne diseases that I was talking about. This is the indicator, computes the vulnerability index of a given country to the Aedes-borne diseases, dengue, chikungunya, and Zika. And it is considering the susceptibility and the coping capacity of the variable. So what we're doing is we are selecting some vulnerability variables such as percentage of population without access to drinking water, gross national incomes, and percentage of deaths by communicable diseases, maternal and prenatal, and nutritional conditions to use proxies for healthcare access. So what this indicator is actually telling us, and this is really not a surprise, but it's nice to finally see it, is that vulnerability to Aedes-borne diseases is highest in countries with low human development index, which is something that we expected. What our key challenge for this year is that we're going to produce our Lancet Countdown South America report for this 2021. We're in the process of identifying our working groups and leads for the region, and after we've done this, we're going to start with a consultation process to identify potential indicators that work for our region with our working groups and leads. This is important because for the last couple of years in the Lancet Countdown report, we've tried to extract the data when we do our presentations and our launches here in South America. We extract the data so that what's happening in our regions becomes more evident. For example, one of the indicators that we've used is vulnerability to extreme, that we see, and then we think that it's important to continue to follow up, is vulnerability to extremes of heat. And for example, wildfires, where we're actually seeing a very, very big impact, especially in Chile, where the populations are at higher risk of wildfires yearly, actually. One of the other things that we're doing is expand our country level communications and policy engagements. For the 2020 launch events, we had 5 events. Three countries had the events in parallel, and then we have 2 additional events in Argentina and Chile, which I think we were extremely successful. And we want to expand it to 2021 so we can actually include more countries that are going to be part of the engagement for our 2021 launch. The last thing that we're doing at the center is we are, as we're saying, we expand our country level communications, but also we're trying to engage more policy engagements. We have developed a policy brief for Peru, where we have identified 3 key issues that our politicians should tackle, and that is conduct city-level climate change risk assessments and allocation of necessary budgets for this. We have identified the second priority is investment in the reduction of air pollution, and the third priority is promote an integrated territorial management mechanism targeting to reduce vector-borne diseases. So we're doing several things in different aspects, and just to finish, and I think I am 1 minute over, is that we want to invite you to be part of the Lancet Countdown South America and contribute as partners, research, expand country level communications, and engage your policy. I will not, before I leave, I just want to thank this amazing group of people that make this possible. And I hope that for next year, we get new faces in this slide. Thank you very much for your attention. But before I go, I have to introduce the next portion of the meeting. And by that, I'm going to introduce Marina Romanello, who is going to be the moderator of the next portion. She's a data scientist and research fellow for the Lancet Countdown. And she leads the research of the collaboration and is in charge of the scientific development and refining of the Lancet Countdown indicators. So if you have questions about the indicators, I think Marina is the person to go to. So Marina, there you are. I wasn't able to see you because the presentation was there, but I leave you and have a great panel, everybody.
Thank you, Stella. Thank you so much. And hi, everyone. Hola a todos. So we've heard a lot about the Lancet Countdown's work, and we heard a bit about climate change and health, particularly in South America, which is the region hosting this year's event. And South America, as Stella already presented, is very particular in its relationship with the natural environment, and it's also highly vulnerable to the climate change risks. We have vector-borne diseases. There were in 2019 over 3 million new cases of dengue. Dengue is the most rapidly expanding climate-sensitive disease in the world. We have a region that is very vulnerable to extreme weather events, to anything that affects our crop productivity, food productivity. And above everything, we're a region that has the biggest natural carbon sink in the world after the ocean, is the Amazon rainforest. So we also have lots of potential. And South America, all of us that are from here and all of us that know about the region, still has a lot to do in terms of development, still has a lot to do in terms of achieving well-being and prosperity. And the key challenge now is how are we going to achieve that prosperity and that well-being while still respecting the natural boundaries of our environment? So that's where we're in need of what we call the great transition. We need to start reinventing the way we develop, and we start rethinking the way we develop in order to keep within planetary boundaries. So in order to discuss how that might happen in South America, I'm thrilled to present to you our great panelists. We have Dr. David Rojas Rueda. David Rojas is a professor at the Colorado State University. He collaborates with local and national governments and organizations on environmental health issues. He is an environmental epidemiologist with experience in burden of disease, health impact assessments, and citizen science. In the last 10 years, he has been involved in national and international projects on environmental health, climate change mitigation, air pollution, and the evaluation of policies to improve public health. So there's David. I also wanted to introduce to you Gretel Navasobando. She's a PhD candidate at the Institute of Environmental Science and Technology of the Autonomous University of Barcelona. There she works for the Environmental Justice Project funded by the European Research Council. She holds a master's degree in socio-environmental studies from the Latin America Faculty of Social Sciences and a bachelor's degree in international relations from the National University of Costa Rica. Her current research interests are political ecology, environmental conflicts, and environmental justice. In her PhD, she's analyzing environmental conflicts in the context of toxic pollution. We look forward to hearing from her in that. I also wanted to introduce to you Dr. Armando Valdez Velázquez. He has doctorate in zoology and geography from the University of Borne. And since 2017, he's associate professor at the Universidad Peruana Cayetano Heredia, where he directs the Eco Health and Urban Ecology Laboratory. He's also a board member of CLIMA, the institute where also Stella is from, and he's a researcher of the Lancet Countdown South America. His area of interest covers the interface between human beings and nature, focusing on the management of natural resources, the conservation of biodiversity and ecosystem health in a climate change framework. He also supports conservation and development projects, teams in design, implementation, monitoring, and evaluation of their interventions. Hey, Armando. And finally, I wanted to introduce to you Dr. Laura Gazzardo. She's a professor at the Geophysics Department in the University of Chile. Until March 2019, she acted as the founding director of the Center for Climate and Resilience Research in Chile. And her research interests are broad and cover atmospheric modeling, short-lived climate forces, and urban climate vulnerabilities. She has made original scientific contributions aiming at characterizing human perturbations of the climate system. And I would have loved to introduce to you Juan Carlos Arteaga, but he's not going to be able to be with us today because he's doing a very important humanitarian mission in the Brazilian Amazon city of Manaus, in the middle of a huge, devastating COVID crisis. So I think we can use him for not being here. So as we were saying, South America is very interlinked with the environment and still has a lot of development to do. We have around the world about 56% of the total population lives in urban areas, but that in Latin America rises up to 81%. So we have a highly urbanized population in cities that are expanding and developing in general terms quite unsustainably. So I think my first question will go to David Rojas. David, how do you think that Latin American cities can start shifting and functioning to be within their planetary boundaries as they develop? And what do you think are the pillars that we need to put in place to ensure that that sustainable development happens?
Thank you, Marina. I think there is a great opportunities at the city level. So if you think cities as a planet, there's many things to do there. And for the public health perspective, there's a lot of opportunities. We have a lot of mistakes in the urban design and development, and grow in the cities do not follow some kind of regulations in Latin America. But at the same time, we can introduce nature, we can introduce safety, we can introduce air quality. If we design better, if we can introduce an equity vision in that process. So I think pillars will be introduce natural-based solutions in Latin America. Try to identify co-benefits of urban design and transport policies that help us to be more active, but at the same time reduce emissions of air pollutants, CO2. So there is many other co-benefits. So the interaction with nature now, we know that is good for health. So adding more trees, even some grass, that is very good for health. And this is some ways that actually we can gain quality of life and life expectancy. So that it will be the first frame of the opportunities there.
Thank you, David. And you mentioned nature-based solutions and green spaces. I think the concept of urban green spaces has shifted during the pandemic. I think all of us that were lucky enough to be close to a urban green space completely appreciated them in a different light. And you also mentioned something there to do about the co-benefits, the health co-benefits of mitigation and air pollution. So I would like to go a bit deeper into that, and particularly what happened with the pandemic. And perhaps Laura can help us with this question, because you've done a lot of work in air pollution. So during the pandemic, we saw around the world as lockdowns were implemented, and for all the wrong reasons, that urban air started getting cleaned. We saw for the first time that you could see the Himalayas from different Indian cities where kind of you couldn't see past a couple of miles before. And I think something similar must have happened surely with Chile, again, for all the wrong reasons. But what do you think could be perhaps the learned lessons, or what has the pandemic shown us about the opportunity of cleaning air and of enjoying that co-benefit of decarbonizing urban areas in terms of better air quality. And how can it be applied in the longer term to Latin America?
Well, to begin with, the COVID pandemic, in fact, it reduced a number of particularly mobile sources, reducing nitrogen oxides. However, and also particles, which is already a good news. Nevertheless, there was more of ozone in several cities, at least in South America and several other cities, which in turn also produce secondary particles, which tend to be more toxic than primary particles. One thing is to breathe dust, and another whole different story is to breathe something that is in part some kind of cancergenous species or so. But yes, and that shows I would say the warnings we have to have in mind when developing new transportation systems, when developing the new scenarios. There are also emerging problems that we have to take into account, like this ozone pollution with its many consequences, not only on human health, but also on vegetation, etc. So there are these couplings and these non-linear phenomena that are so characteristic, and that we need to think differently from what we have been thinking so far. But yes, it's shown that it's possible to rearrange the working days, to perhaps have a distribution of work, part at home, part not at home for some. It also showed the vulnerabilities and the inequities of our societies, like access to internet, which differ greatly between different places within a country and among countries in our region. And so it was a bit of a mixture but I guess the opportunity is that we have to learn to deal with complexity, and there are ways forward and things that can be done, and we can adapt and adjust to those changes. I don't know whether I answer your question, but that's my first reaction.
Many more questions that I'd like to address at you at some point if we manage today. That's really fascinating. And I think you pointed at something. You said two things that to me are quite critical. One is about the complexity and how interrelated everything is. And it's really not linear. There's really a lot of interrelationships with our natural environments that are constantly changing, and it's a complex system. And the second has to do with equality, that you also mentioned, the challenge of equality. So I think I will shift now to perhaps to Armando. Armando, you as a scientist are doing a lot in terms of translating evidence to policymakers and getting the academic community to be able to push decision makers to promote development and economic development in a way that does respect those planetary boundaries. And I think it's really critical the academic community is heard, and particularly because of what Laura was saying, how complex and how dynamic everything is. So what do you think the academic community can do to ensure that it's more listened to and that it really enables policymakers to take those decisions?
First of all, thank you, Marina, for this invitation. It's a very interesting question what you asked, and it's a question that's we've been trying to answer for a long time. I think that the major issue is that we are separated into communities of understanding and of the level of information, of detail, of analysis that we do. It's a very different for policymakers, what kind of information they deal with, what kind of information they use to make decisions in academia. And for me, that the way forward is basically to collaborate. I know it sounds fantastic. Yeah, that's what we need. We need to work together. But basically, all behavioral change models show us that information by itself is not enough. So I can publish whatever you want me to publish. I'll publish it, but that won't help. it won't reach, or in a general terms, it won't reach the policymakers. So what we need to do is not only think about translating information into to generate a dialogue, but is to basically try to collaborate with them. We are all facing similar problems. When we talk about different communities within a country, we're talking about similar problems. The problems that the policymakers are facing are the same problems that we're seeing in our reality, in our situation, in our context. And across countries, we're also facing similar problems. So I do think that what we have to do is extend the hand. There's a great book called Out of the Ivory Tower, and I think that's a great book for academics, because it's basically that: get out of the ivory tower, walk across the land, and shake your hands with the policymakers. And all collaboration is built on trust. So when we close the doors of our community, especially the academia, and we don't need to open them. I'm going to be really, really blunt about it. We don't need to open it because we've got the ears of the community there. If I publish a paper, my fellows will read it, my fellow colleagues, and everybody will read it. And I feel that this feedback and constant being reference and whatever. But what I need is to go across the hall to the other side, to the policymakers, knock on their doors, and start talking about their problems and how I can be somebody they can rely on to try and solve them. Again, this is not a minor challenge, and I mean we as academia, are not always prepared or have the skills to do this. So looking for support in the behavioral sciences, looking for support in the policymakers themselves, looking for support in everybody that already does that. Let's try and work together and bridge that gap.
That's a really good reflection, Armando, and that's bridge, that's being able to talk different languages to different actors, that sometimes we do end up in these silos. And I think that is one of the keys. I think there's another group that has not been mentioned so far, but it's also really crucial to our development and to our response to the climate crisis. And it's particularly strong in Latin America. That is the advocacy groups and the kind of the groups of social responsibility. And I'm wondering, we have so many advocacy groups in Latin America, many of them addressing different environmental causes. And perhaps I wanted to ask Gretel, with your experience on this, if you could tell us a bit about what opportunities exist to bring together different Latin American movements so that they can still follow their causes, but help come together in ensuring that we do achieve development within our natural boundaries.
Yeah, thank you very much for the invitation to this panel, and of course for all the organizers to this amazing conference. Yeah, I think the context in Latin America, it's very different, no? I mean, all the history of colonialism, and I mean, that history makes the region particular, and the history makes like, it's like shaping the path in how decisions about the environment it's taking place nowadays, no? But I think to respond to the question, I think two key points is to guarantee recognition and participation to the Latin American movements, which are like two main pillars in the environmental justice field, no? All around the region, grassroots organization units like to not only to resist against ecological destruction, but also to propose alternatives to a more just and sustainable society. But I would like also to point here in one particular issue that has just been published in Planetary Health. No, I don't remember right now the names of the authors, but they were some authors from Colombia. That the title of the paper was "The Role of Violence in Planetary Health." And unfortunately, yes, one main challenge for Latin American communities which struggle to safeguard nature and their livelihoods is violence, direct violence. So many environmental defenders, and this is a key characteristic in Latin America, but also in Southeast Asia and in Africa, that means the global South, no? Is that environmental defenders have been killed. And this is a very striking context. So I think one urgent need is first, as I said, to boost alternatives that are proposed by grassroots organizations from a bottom-up perspective. But also there is an urgent need to guarantee their safe participation in this decision-making, no? In their participation in their, with their values, with their interests, with their historical livelihoods. And well, a great opportunity, of course, is something that we have been talking in the last 2 weeks, especially last week, which is the Escazú Agreement, no? A regional agreement that the second regional agreement after the Aarhus Convention in Copenhagen. It includes specifically the protection of environmental and human rights defenders, and it guarantees the access to information about environmental risks, and it gives them protection to their defense, their participation, and to guarantee their participation in environmental matters, no, in general. So I think, yes, it's a challenge, but there are some opportunities that are taking place. And of course, I hope that ratification will come not only for some, but to all the countries in the region. And of course, that it helps for some inspiration for other regions also.
Thank you, Gretel. Yeah, and the Escazú Agreement, it just came to force, if I understand correctly, very, very recently, and it's quite fundamental for the region. Perhaps I would like now to shift to Laura again, if you don't mind, Laura. And I know that you probably have something to say about the Escazú Agreement,
well, yes.
But I wanted to ask you, in that context, what are the opportunities and challenges that you consider have to be tackled and faced in order to make the planetary health vision a reality for South America, perhaps in direct relation to the Escazú Agreement?
And I have 2 minutes? Okay. Well, one fundamental thing, of course, is the aspect of justice, of information for everybody, of knowledge of what's happening, and having a voice in decision making. That the Greeks used to call it democracy. And that would be a very good idea still in many of our countries, because even if we vote from time to time, still participation is scarce. We have looked into the participation in environmental plans for dealing with air quality in Chile. And in general, the people who participate are academics, people in industry, and in general, groups of interest, but not citizens. Is rare to find the participation of citizens. And when you are dealing with complex issues like climate change that require behavioral changes, participation is absolutely critical, fundamental here and everywhere else. Now, in the case of Chile I don't get it, why this government didn't or refused to sign under this agreement, particularly it's contradictory with tradition we had, and Chile was promoting that until a few years ago. Even the current president at one point said, yes, of course, we are going to sign. And then they argue some kind of funny arguments about borders and international law that nobody understood, particularly lawyers specializing in that. So there is something funny about that. But well, there are elections coming up. So let's hope for a change regarding that. Now, the second, your question, Marina, is super difficult, but perhaps it also has to do with democracy facing inequity in this part is absolutely fundamental. This morning, I was talking to a student in London, but he's Chilean. He was looking into the policies we have in place here for dealing with disaster management. And even though Chile has progress and we have some experience regarding earthquakes and some other disasters, and in some of that we have performed quite well, still long-term planning is missing. And that long-term planning cannot be a very hierarchical process in which someone, very enlightened person or persons, decide what to do, but we need to have the engagement of people of all sorts, kinds, shapes, and colors. And to do that, definitely we need this type of agreement and social consensus regarding participation, going much beyond the typical consultancies they do, or these questions from time to time. Do you agree with this project or not? No, it's much more than that. And we need the people to be there. And even though I'm not a social scientist, I know enough to say that it's absolutely necessary, because otherwise things don't work. So democracy is a good idea to revitalize in our countries, I would say so.
Definitely. Yeah, I would echo your comments, Laura. I think it's a very, very good message. And I think there's one group, particularly in South America, which is quite strong and which has been there perhaps more than my ancestors have been in South America, and that have very, very close links and have lived in harmony with our environment. Not that they're always sustainable in their practices, but they are very, very dependent on the natural environment, and that's the Aboriginal communities. We have Aboriginal communities throughout the region, and they're extremely vulnerable to the impact of climate change, and they have lots of knowledge and wisdom in how the climate behaves and how the natural systems behave. So perhaps I'll turn to Armando for this question, because I know you worked a bit with Aboriginal communities, and I'd like to ask you what you think the best way of integrating that knowledge is to mainstream decision making, and the way in which we can really bring a voice to those communities, which in general, they're not mainstreamed into policy making and are generally quite neglected by our policies.
You got the tough questions there.
Yeah, sorry.
I do, yeah. Working with indigenous peoples and it's a difficult scenario, mainly because we're bringing this 500 years of history behind us, and you can't forget 500 years of history in any given amount of time, maybe in 500 years, but not before that. So there has to be a lot of respect, and there has to be, again, a lot of trust. And to build trust, it means to listen, to sit down and listen. And there are a lot of examples, not necessarily with climate change, but with the way we use nature, the way we interface and interact with nature, the way we use the territory, the land, the way we live on the land, where, especially in the Amazon region, where collaboration has been really enhanced between researchers, I would say westernized academic researchers and indigenous researchers. And I'm going to say researchers because that is not a thing that you have to use a specific method. You just have to do what scientific method says, and that is basically have a question, propose an answer, try it out. If it doesn't work, then probably it's a negative, and then go on and make the next question. This observation, this cycle of scientific research is in every kind of building knowledge. It's not is only exclusive of Western science. And that is important because I think we have to be on the same level. Indigenous peoples, as you said, have an incredible amount of knowledge, wisdom, I'm not going to even say information, it's wisdom, what they have regarding the the cycles of nature, the way the territory behaves, the way hydrology behaves, the way it's changing, the way rains and soil and everything behaves in a bigger scale than what we have. And I'm also a professor, so one of the things I used to do with my students was for them to create a myth. They were listening to myths, to indigenous peoples, myths from Peru, from indigenous peoples in the Amazon, and they had to create a myth. And that myth had to have exactly the same amount of ecological knowledge, climate change knowledge, territorial knowledge that the indigenous peoples' myths have. I mean, it's a myth. It's a beautiful story. There's a protagonist and everything. And we normally as scientists, we read a paper. The paper has a structure. You have to shift. Now let's listen to a myth. The myth has a structure. There's a protagonist, there's a dilemma, there's a challenge, there's a solution. All that, there's ecological information. There's hundreds and hundreds of years of knowledge and wisdom coming out of that. To do that, we have to change our educational system. I mean, it's basically, when we talk about intercultural education, we're talking both ways. It's not, okay, we have to improve the way Western education is brought to indigenous peoples. It's also, how do we bring indigenous peoples' knowledge, wisdom, thoughts, thinking, emotions to Western civilization? And how do we make them work together to solve our problems? So yeah, that's basically what I have to say.
There's just so much ancestral knowledge that we need to start, as you say, respecting and learning. So much to learn from them. I think I'll just go to one further question, and then we'll go to questions from the audience. So if you do have your questions, just pop them on the Q&A chat that you can find at the bottom of your screen. And I think the last question I'll direct at David. And I want to finish on a slightly different note. And David, we're at the moment facing two big crises, very, very big crises that are perhaps like never seen before. One is obviously the COVID pandemic that has brought the world upside down into a standstill. And the other is obviously the climate crisis that is as much more on the longer term, but is probably even more destructive unless we do something about it pretty fast. So what I wanted to ask you, do you think there's any window of opportunity in terms of public health policies that can enable that transition to a more sustainable system? And what do you think those are?
Yeah, definitely. So I think the COVID pandemic brings more sensitivity to the public. So they now are more aware about what our environment, even our urban environment is. So as you mentioned before, like those that have the privilege to be near to a park or green space, or have a larger house, or be more near to amenities, they enjoy that opportunity or possibility. How we move have changed in the cities. So now we are seeing that probably those that have the risk perception that they don't want to be in contact with a lot of people, they will choose to move to another mode of transport. They were using probably public transportation, and they are requesting and demanding more public space for walking, for cycling. So there is a new boost and interest. And when you walk in many cities, you see the sidewalk is so narrow that you cannot make this 2 meters or 6 feet of distance. So, and then you go to the corner and the traffic stop, you need to push a button to actually request the green signal for the pedestrians. So when you should not be touching these surfaces that could be contaminated. So there are many things that we are now more sensitive to, and there's a great opportunity to actually add these changes, not only in the community, but also the policymakers are seeing that there is a demand. They need to expand a little bit the spaces, even the parks. The demand for these public spaces now is increasing, and there's not enough space. Probably expanding these public spaces, parks and areas will be a great solution. So we are seeing many of those, but also in terms of traffic accidents. Now we know that our health system is in crisis too, because there's a lot of demand. So in the emergency rooms, you have a lot of patients, and we don't want to create more patients that need to use the services that they suffer a traffic accident. So we need to implement policies that reduce those demands. if we make a better design of those cities, we can actually reduce the demand of those services and be able to provide those services to those that are needed during the pandemic. But that gives us the sense of what is the future. We can improve health systems with urban designs. So there's many opportunities here. And again, this is something that the other panelists mentioned. This is something that we need to work with the stakeholders, policymakers, and communities. This is a great opportunity for us to take the leadership to push these changes.
Really interesting, David. And I think also that would help reduce the carbon intensity of our health systems as well at the same time. So big co-benefit there. I think now I'm just going to pass on to the Q&As. And there's a question that was asked some while back, but I just thought it was quite interesting. And perhaps, I don't know if Laura, you would feel comfortable or you can pass on to someone as you don't. But the first question is by anonymous attendee. And what they're asking is, how do you feel about net zero? And is this being used as a smokescreen to continue business as usual, built on a promise of carbon capture technologies that are either non-existent or unsustainable? And if so, can we use any other target? So how do we feel about net zero, considering that the net has to do with carbon capture or some other way of taking carbon off the atmosphere?
Well, yesterday I think I got a copy of I think it appeared in the conversation in some journal or something. Sir, how was his name? Watson, Professor Watson from somewhere, and some other people talking about shortcomings of net zero. In fact, it's been discussed to what extent that is just some smoke, which is not correct, but anyway, for keep living the way we have been living, particularly those of us who have more, keep doing the same things that we have done so far. But in fact, in the IPCC report that came out in 2019 regarding the 1.5 degrees, there are ways to get to net zero without geoengineering, without, so there are ways forward that would allow achieving net zero without those solutions, those potential solutions. That's the issue. Geoengineering hasn't lived up to promise in quantity and extent sufficient security for the future. And when we come back to South America in particular, then it becomes absolutely, I would say, crazy, given the natural, I don't know, we have water, we have ocean, we have sun, we have along the Andes, we have geothermal energy. I mean, before going for putting sulfur up in the stratosphere, I think we have to go through some other more basic stuff, like creating cities that are livable, walkable, etc., with co-benefits for health, than going into these other things that come sometimes with the idea or the underlying idea of having keep doing the same thing as we have done it for the last 200 years. And that's not a solution anymore. Now, having said that, for my students, they have to look into geoengineering nevertheless in order to understand what's been proposed and to understand and to be critical in a scientific manner to that. But yes, the point is that we can reach net zero as something that we can foresee, but there are ways to get there without going into too many fantastic solutions.
And I think in South America, we also have a huge carbon sink that we're just chopping off, aren't we, with the Amazon rainforest? And I think the budget for conservation of the rainforest got cut by 20% just after commitments were made in the Leaders Summit the other day.
And also the energy we use, water is still a great source of energy in South America. So our dependence on fossil fuel is probably less than elsewhere. So we have a chance to do it, and to do it with our own energy resources. So why not?
Thank you, Laura. Thank you for that very comprehensive answer. We have questions here addressed at Gretel. I think it's quite interesting, by Rafael Perroni. And Rafael is saying, do you see opportunities to inhibit violence against environmentalists with the uprising of intolerance?
I don't, can you repeat it again? Sorry, I had a problem with my headphones.
Yeah, for sure. So Gretel, do you see opportunities to inhibit violence against environmentalists with the uprising of intolerance? How can we inhibit violence against environmentalists now that there's so much intolerance around?
Yeah, I think without many initiatives in the region, no? Just let me say that when violence in its more highest expression, no, which could be like the murder of environmental defender, there is only like the point of the iceberg, no? We are forgetting here to study, for instance, structural violence, cultural violence. There are many like ways in which we can predict. And another point is like many environmental defenders raise awareness about the difficulties that they are facing, and sometimes also the states give some kind of protection. But we have learned from the past, I mean, from Chico Mendes in the Amazonia to Berta Cáceres in Honduras, many years have passed there, and it continues the same, no? So I think, and I am very optimistic that this kind of binding and legally binding agreements can shape a little bit in how governments and private sectors behave against those who protest against specific projects. And they protest not because they don't want this project, they protest because their livelihoods are at risk, their rivers, their mountains, because also they have different values, no? When doing fieldwork in Colombia, I remember that there were some communities that were against a mining project. And a scientist, a colleague asked to him, like, but this mining project is not in your territory. I mean, what you are against this project? And they said, no, because Mother Earth, no? So this is other language of valuations. This is other vocabularies, other notions about how people, I mean, these local communities, no, have different, values, let's say. This is one point. And the others, I will say that impunity. Global Witness, which is this a British NGO that gives every year reports about the names of environmental defenders that have been killed, have a stricken percentage of the impunity of this murder. So I think if we can also end with impunity, it can also be a good,
Brilliant. Thank you, Gretel. And I think I'll ask us one more question and then we'll just close, because we're going to run a few minutes late, but I thought this question was quite worthwhile asking, and it will end, I think, on a positive note. This is what we all need these days. So Beatriz Sinelli Laham is asking, how can we scientists influence decision-making in political context of science negationism? I think perhaps you, Armando, are suited to answer this question. How can scientists influence decision-making in a context of science negationism? All the hard questions to you, Armando, sorry.
Yeah, you're making me sweat. That's a very difficult one. Science negationism is not only a trend right now, it's mainly a trajectory that's increasing all the time, but it's being used politically. So that makes it even more difficult. I mean, one thing is to have people who don't believe or are conspiracionists or something like that. They don't believe in the effect, the positive effect of vaccines. Another thing is to negate the whole model that we follow in order to attain some level of truth. And that is the problem. So we do have to start, I think, in two ways to do this. The first one is science has to be a major component in any educational reform. We have to start doing it, science education. Everybody has to be a scientist. This is not something that only academics want. No, everybody has to have some level of inquisitiveness and some level of curiosity, some level of trying to do science in their backyard, in their kitchen. I mean, cooking is science, so why not start there? It's chemical science, it's chemistry and physics in the most amazing levels, and then nature and even in the city, urban green spaces, what's out there, observe, regain that curiosity. That's what makes it for everybody. But that's just one, because educational reforms take generations to work. The other one is policymakers. Is to start showing that policymakers use science. I know this is difficult in a world where Trump has been president, but it's also possible, I think, for us scientists to start opening our doors, going across the hall again, going to those policymakers and saying, I've got something to show you, something that might be important. I mean, to be honest, all oil and gas companies have lobbyists in their midst. They pay people to go and knock on doors of policymakers. Scientists, we don't. So why not start there? Let's start putting some of our time and treasure and money and everything into knocking on those doors. Some of them will close, some of them will not open, but some of them will. And I've had amazing opportunities here in Peru, which is a difficult country still, from the Congress, that they've asked for talks about climate change, of trying to understand climate change, trying to see what is this that everybody's talking about, or that I see somebody telling. And you know, climate change is kind of like the big box where you put everything. Oh, why are we having more El Niños? Oh, climate change. Why is it not raining here? Oh, climate change. Why is this climate change? So we have an opportunity here to really interact with them and start talking about the information that we really want, we think, and they think that they can use in every day. And I think that's really important. Sorry if I took a little bit more time.
Thank you, Armando. No, thank you so much. That was a very important message, so I'm glad you did. I think we're 3 minutes late, so I'll bring this to a close. But we heard very interesting work being done in our regional centers today, and then we dove deep into South America. We heard about how we can democratize our climate change policymaking and how important it is to bring voices to everyone in South America, regional communities, the youth, the different movements that we have in the region. We heard about the co-benefits and how to leverage on those co-benefits. And we heard about the wealth of opportunities that we have in South America to actually not need those kind of technological developments to be able to reach net zero within our boundaries. And in a region with such high vulnerabilities as South America is, it's so important that we really put health at the center of climate policy so we can protect our children and the future generations, as well as the present ones, which are already struggling with COVID. So we might as well give ourselves a hand. So the next event in the PHAM program is on the Caribbean, where we have some speakers that have contributed to the SEEDS report that Georgiana just mentioned. So as we close this up, and I'm going to give the word now to Anthony, you might want to head down there because it's going to be really interesting. So thank you so much, and thank you to our wonderful panelists today for such interesting insights.
These are from Tanzania. All these ones.
Thank you.
Anthony.
Just to say thank you. It's been a wonderful discussion. Thank you so much for all the panelists in this. I've really enjoyed it, and I'll let everyone now go and have a meal or a drink. Thank you.
Thank you, everyone. See you at 6. Bye.
Adios.
Adios.